Welcome everybody to today's training on human trafficking and clinician awareness. My name is Richard Schoeberl. Today, along with Kelly Cloonan, we'll be talking about human trafficking awareness, but particularly in a clinical setting. And I want to go ahead and get started with this. The training that we have developed, myself and Dr. Cloonan, this is the same training that we developed and delivered for the Department of State, in which we delivered to multiple embassies abroad on raising awareness within a clinical setting. A little bit about the organization itself that is delivering this. Hope for Justice is a international nonprofit. Currently, we have locations on 5 continents with an upward of 40 offices across the globe, including here in the United States. We work to prevent exploitation. We work to rescue victims. We work to restore lives and reform society, particularly in reference to the anti-trafficking movement. This is part of our platform on preventing. We are strong believers that awareness leads to education, and education leads to rescues. As we go through this, a lot of people have misconceptions about what human trafficking actually is. When we look at human trafficking, we want to make sure that we understand the definition, and there is a lot of definitions out there, but we look and lean towards the Department of State, which develops the Trafficking in Persons report, and the Department of State defines trafficking as the recruitment of individuals, harboring of individuals, transportation, provision, but the main focus we look at is force, fraud, and coercion. Somebody who is exploited for sex or labor through the use of force, fraud, and coercion. And a lot of individuals will ask sometimes, well, the individual might be on drugs. Is that a form of control? Is that a form of force, fraud, or coercion? Absolutely. And when we're looking at this from a legal perspective, only one of these elements need to be met in order for it to be considered trafficking. Now, some general facts, just for everyone to understand the severity of what we're looking at with this problem of human trafficking. Almost 25 million people in the world are victims of human trafficking. An upward of 5 million of those are exploited sexually. This is a business. This is a $150 billion a year business. And people always ask, why is it so prolific? Because of the fact it's a $150 billion a year business. And when we look at the facts of it being asked, why is human trafficking the second fastest growing crime right behind drug trafficking? Because you can only sell that drug once, but you can sell that girl or that boy over and over and over again. And that's what's made it the second fastest growing crime in the world. Now, when we look at where you are, where you might be joining us today for this presentation, you can look here on this map and you'll see various numbers. These various numbers indicate the ranking according to Polaris Project and the National Human Trafficking Hotline for the number of human trafficking cases and calls that come in. Now, each one of these states that are numbered doesn't mean they're the only ones where human trafficking is happening. These are just the cases that we have listed as the highest number. So as we continue to kind of put some facts out there for you to understand how prolific of a crime this is, 76% of trafficking victims are female. 76%. So sometimes if you may hear me say, you know, her or she or whatever, it's not because men don't get trafficked. It's just a majority of it, 76% is happening to females. Of concern for us, not just trafficking victims themselves, but trying to prevent this from happening in the first place is of the utmost importance. We know that there's an average of about 2 million runaways in the United States. 1 in 3 of those runaways are likely a human trafficking victim. 1 in 3. So the importance of locating these individuals when they leave home and identifying those who are at risk is of the utmost importance to prevent them actually from being trafficked. We know also too that anywhere on an upward of 40% of homeless people are also trafficked. And people say, why is that
Take
happening?
my phone.
Individuals resort to what we refer to they have no choice but to resort to this. They have no phone, they have no home, they have no money, they have no food, no shelter. Most of these victims, when we look at it, the average age of the girl entering this trade, this sex trade, is between 12 and 14 years of age. For boys, it's even much younger, between 11 and 13.
So one of the things you're probably asking yourself, why are we doing this as a clinician training? Why is this important? And it's for this fact right here that you could see on the screen. 87.8% of human trafficking survivors had been in contact with a healthcare provider in some capacity while they were still in captivity. So to understand this, to realize that, I mean, almost 90%, 9 out of 10 trafficking victims see a healthcare provider while they're being trafficked. So this is where this training is so important for everybody to hear across the entire United States. As Rich said, there's trafficking happening in every state. There's not a single state that it hasn't happened in. And so this is so important for us as healthcare providers to know how to identify these victims and know what to do if you identify them, or how to screen them. And that's why you're here today. And of those 90%, 68% were in the emergency department. So they may be, you know, at the dentist or for a surgery or some type of outpatient, but about, you know, a large amount, almost 70%, were in the emergency department being seen. So with COVID, that has really made an impact on human trafficking. People are more vulnerable with labor and sex trafficking. You know, different services have been shut down. There's just a lot more vulnerable population, which we're going to talk about in a moment, of why that matters. So COVID has really exacerbated human trafficking in the United States. It is up 185% from last year. So I just think about that it's almost doubled. That's just crazy to me, 185% from last year. And this is something that I want to touch on. So we're talking about clinician training, but all of us are part of some kind of family or have friends. And so there's a couple of facts I wanted to share with you guys today that we thought were so important for you to hear. 1 in 5 children are sexually propositioned online. 1 in 5, okay? The National Center for Missing and Exploited Children reported a more than 90% increase in the reports of online enticement. So meaning, you know, traffickers are trying to seek kids through gaming, smartphones, live streaming, YouTube. I know just the other day I was watching something with my son, and it was something Disney. I forget what we were looking at, Disney World thing. It had millions of views, and we clicked on it to watch. I think it was a ride at Disney World, and it was this real creepy thing. But if all I was hearing was the music part of it, and I know you guys have probably heard about this, but if I had just heard the music, I would have thought nothing of it. But I was watching it with him, and it was extremely creepy. I don't know what was going to happen later in the video, but it was very disturbing and clearly trying to pull children in. But the same is happening with this trafficking, where these traffickers are, you know, kind of throwing out this wide net, saying, you know, they're propositioning multiple kids at a time, and all they need is a couple to say, oh yeah, sure. Oh, who is this? Or, oh yeah, sure, I'd love to talk to you. And you know, they're you know, presenting as younger people. They're not the people they're pretending to be. So this is a very big deal, and kids are online so much more with the school happening online. But keep that in mind, that 1 in 5 kids. So it's so important to monitor this. And, you know, this term of it becoming a massive online hunting ground for human traffickers is just so disturbing to me, but something to make sure to keep an eye on your kiddos and family members, and just keep a rein of that. And some things to look for, if you want to go to the next slide, Rich, some things to look for when you look at this online grooming. So some things that maybe in your kids, we've heard some stories of, you know, kids being trafficked right within their own home through videos, pictures, things they're being forced to do. Look at some of these behaviors in your kids or someone you know, or something to share with others. Are they really secretive? Are they getting gifts that they don't want to talk about, or how they're getting that? Are they getting really scared when their phone rings, or do you see them kind of getting nervous when that happens, or when they have to leave the room to go do something and want to be alone? Are they really distracted, spending way too much time on the internet? withdrawn from family and friends, kind of withdrawing from the family, not wanting to talk as much, getting really vague in the way they're answering questions, or maybe they have a new boyfriend or girlfriend and the way that they're talking about them, is just a little bit, they don't want to share much information. And again, the challenge with this, with teens, we know teenagers don't love to talk as much necessarily to their parents, but just want to encourage you to continue to do that, even if they don't seem to, and watch for any changes in their behavior, and monitor what they're doing online. It's your right and an important responsibility as parents to do that. So knowing this is happening, knowing 1 in 5 are propositioned, it's a good idea to check in with them and even ask them directly if this is something they're experiencing.
So one of the things that we have seen is how media shapes the way human trafficking thoughts are projected. A lot of people think that the movie Taken came out and it highlighted human trafficking, and everybody thinks people are kidnapped and then they're sold into the sex industry. And Hollywood has really, and the media has really sensationalized this. This is not typically how someone is trafficked. And we need to understand that, does this happen? Certainly, yes, it happens. But this is not typically how it happens. When we look at somebody being trafficked, there's a lot of misconceptions that follow it as well. And we need to understand those misconceptions. And a lot of people don't understand that it is a crime that only involves foreigners. That's not true. It involves U.S. citizens. In fact, 80% of the cases last year investigated by law enforcement were identified as U.S. citizens and here in the U.S. Now, a lot of people are asking, with the crisis that's happening right now in the southwest border, are we going to see a rise in trafficking cases? And I think it's only smart to assume, yes, we will, because these individuals are coming in a vulnerable state and they are going to be susceptible. And we'll talk a little bit about that as we go through here. And that's why it says it only requires foreign or interstate travel. Not the case at all. Not the case at all. A person can be trafficked. Remember, force, fraud, or coercion. A person can be trafficked on the same street they grew up on. They don't have to go interstate. They don't have to go between states or between counties or anything else. They can be trafficked in the same state that they were born in. It's only related to the sex industry. That's not the case. We'll talk about the different industries here, but it's not related to just sex. You got sex, labor, domestic servitude. There's so many different ways. If they're paid, they aren't victims. Not true at all. There are people who are actually paid and still trafficked, particularly in the labor industry, when they're not paid a fair price. They're paid just enough to survive, just enough to eat. Sometimes victims self-identify with themselves too. A lot of the victims that I've spoken to in regards to trafficking really feel like they put themselves in that situation. And I don't think anyone's ever raised their hand and said, please traffic me. That's never happened. And a lot of them feel like they don't deserve anything better in their life. This is just where they ended up. They just accept it. And that's unfortunate that we would allow that to happen, that someone would do that. But one of the misconceptions that we have to understand is the difference between trafficking and smuggling. Okay. A lot of people will, and the key word is voluntary or involuntary. A lot of people will voluntarily ask to be smuggled into the country. Whether you agree with immigration, don't agree with immigration, that's not the debate here today. What we're talking about is people who do come in are at the most vulnerable state. So there is crossover between smuggling and trafficking because of the vulnerability. That's what we're looking at. It's a vulnerable population. But there is a difference between the two when we talk about it. So let's talk a little bit about how someone ends up in this particular situation. We have to think about the push and pull factors. Push and pull factors are a key in what drives the funnel to human trafficking. Okay, so what really can push or pull somebody in there? Obviously, socioeconomic status, poverty, those individuals who are looking for a better life, whether or not they're coming from another country or they are a U.S. citizen. The fact is that when you come from a lower socioeconomic status, extreme poverty, absolutely, this can put you into a position of most vulnerable, abusive or neglective home. When we talk about people who have been sexually abused as a child, there is a higher likelihood of them being trafficked or sexually abused as an adult. And when we look at that, sometimes people don't want to stay in an abusive or neglective home, which leads us to another one of the pull factors is runaways, people who run away from home. Okay. People run away from home for a reason, okay, whatever that reason might be. But particularly, there's a higher risk of people running away from abusive or neglective homes, or that instability within the home or instability within the family. But we also have to be concerned with what Kelly was talking about earlier, is the grooming aspect. When we look at the grooming can take place online or offline. Obviously, we're very concerned about individuals being groomed online at this point. There is a higher likelihood that they will be. I will tell you a little bit about an investigation that we worked where a young girl met an individual online through a social media platform called Snapchat, which I'm sure everybody's familiar with. He groomed her online. She was frustrated with being at home with her mom and dad all day during lockdown and during the time of COVID, where she was remote learning. He groomed her for over a period of a month, convinced her to meet him out, and then he basically kidnapped her and sexually assaulted her, and was potentially going to traffic her to his friends before he was caught and arrested, and she was ultimately rescued. But the grooming process didn't take any time, less than this, roughly 3 weeks. So we have to be concerned about that. Substance abuse is also a factor that pulls somebody into trafficking. So we have to be on the lookout for that, whether that substance abuse is drugs or alcohol, either way. I recall an investigation that we did on an individual, and we provided it to law enforcement for prosecution. And the individual said, well, she's addicted to drugs, so it'll make this very difficult to prosecute. And I looked at him and I said, does that make her less a victim because she's addicted to drugs? Most of these trafficking victims are addicted to drugs because it is a means of control for the trafficker. And in an interview with a trafficking victim, I asked her about her. I never used drugs before, but I just wanted my day to go. I just wanted to get through my day, and the drugs helped me cope.
Rich, you got a little faded back. I don't know if I want to repeat that last when you were asking her. Let me see if I can see.
Oh, can you hear me now?
That's better. Yeah.
Okay. And
you're saying you asked her if she was addicted before.
Yeah. And we're asking the victim if she had used drugs before she was trafficked, and she says, no, I used them while I was trafficked to get me through the day. Just to get me through so I could blank out my day. And then I became dependent and addicted to them. So it is a concern when we look at substance abuse and trafficking. All of these are push and pull factors that go into that. People always ask, how do you identify a victim? What are some of the indicators? They don't wear a T-shirt. It's a clandestine crime. They don't wear a T-shirt that says, I'm a human trafficking victim. And traffickers certainly do not discriminate based on gender, race, or creed, or socioeconomic or demographics or status of immigration. They look for the variable of vulnerability. And that's what we're talking about. Those who are most vulnerable, that fits the mold for a victim. But there's not really an exact mold per se, because there's not that T-shirt, there's not that arrow pointing to the victim. So it takes us as individuals within different sectors where we can cross paths with a trafficking victim to identify this. What groups are at higher risk? What are those vulnerabilities that put that person at higher risk? And how do we identify that? Not just one indicator is going to make somebody a trafficking victim, but when you start adding up the variables, that risk level of them becoming a victim reaches a higher level when we start talking about that. So most victims, when we talked about it, are females or young women. 25% are children, actually under the age 16. And this pool, this funnel, is disproportionately affected by poverty, lack of access to education for one, discrimination, and lack of economic opportunities. So when we were talking about human trafficking in general and the different forms of human trafficking, and we said that a lot of people have the misconception that trafficking is only limited to sexual exploitation. Totally not true. You have forced labor, forced marriage, domestic servitude, criminal activity, and organ harvesting. So when we talk about some of, if you've got your mic on, if you want, great.
Well, I'm only supposed to be here until the end of April. So I'll be here for a week. So I feel it.
Did not increase the cure for documentation using anti-inflammatory eye drops or tear duct plugs. To help avoid eye during contamination, do not touch the bottle tip to your eye or other surfaces. Wait 15 minutes after use before inserting contact lenses. The most common side effect is a temporary burning sensation. Ask your eye care professional about Restasis. Now to trick out these lights. Visit Restasis.com to learn more.
Closed captioning and other consideration for.
I think we got them to mute it. Apologies for that. So when we're talking about human trafficking, we talk about the various industries for human trafficking. Okay, we know that human trafficking happens in various different businesses, such as prostitution, hotels and motels, brothels, massage parlors, the internet. A lot of these victims are trafficked over the internet. And we'll talk a little bit about some of these sites that these individuals are trafficked over, and it's important to understand those. And then domestic servitude. A lot of people are like, does this still happen? And I'll tell you a story about an individual who we rescued this past year, who came to the United States to work as a nanny. And when she did, her passport was taken from her. She worked for this family, didn't speak English, never left the residence. And she finally, she was only able to sleep on the floor, only given food that was left over after dinner, after she cleaned up. And she finally had to go to the hospital. She had become very thin and frail. And they took her to a hospital where the nurse, thank goodness, was able to speak the same language as she was. She was from the Philippines and had received human trafficking awareness training from a clinical setting, and was able to talk with this woman and identify that she was a victim of human trafficking. We were able to work with federal law enforcement to get her rescued. But I want to tell you, she was 78 years old at the time of her rescue. She had been a domestic servitude for 37 years. She had been in domestic servitude. She had been to the hospital 3 times before. Once about 5 years after she was here, once after about 10 years, and then one at 37 years. And she was finally identified as a human trafficking victim. That's why it's such importance for us to bring awareness and understand what is happening in certain sectors. And one broad stroke of training isn't sufficient. You really need to cater it specifically, and that's kind of what we've done here. And when we talk about human trafficking and the prevalence of it, you know, Backpage, www.backpage.com was much like Craigslist online, where you could advertise for sexual exploitation, labor, domestic servitude. And the U.S. government found out that Backpage.com was in existence for this. And as you can see, the website was shut down. But then as you can see, this is a $150 billion a year business. That didn't stop the traffickers. They opened up a new page called eBackpage.com, where they're advertising the same services, just utilizing a different means. How about Tinder? Okay, when we look at that, dating sites, we know a lot of these online sites are used for advertising of certain things. We also know that that the sexual exploitation does exist in massage parlors. And we actively go out and work investigations on this. And this is actually a site that individuals have created to tell you which massage parlors are the ones that are providing sexual services. This is another site online that people utilize for advertising adult services. A lot of these sites, we've interviewed several of these girls that we've rescued through this, have told us that when you look at these sites, it's not them posting these pictures. It's not them using the verbiage to advertise themselves. It's their pimp. It's their trafficker that is utilizing these sites to do that. So obviously we want to talk a little bit about sexual exploitation, but we don't want to neglect also too labor exploitation, particularly this trends in differently in each areas, particularly in certain areas of the West Coast and the Southeast. We look for a lot of construction and landscaping and agricultural work, migrant agricultural work. These are individuals that you might see come into the hospital also too. We had a victim that we had worked with and rescued who was working in the construction field and had cut his finger off and his thumb off, and was taken to the hospital and dropped off and left there with no ride, nothing, just dropped off and left there, and went unidentified as a trafficking victim. There was a language barrier, but also too the signs were not picked up on. So when we talk about labor trafficking, we really want to talk about some of the signs. And remember, when we talk about these indicators, that it's not just one indicator. Just because an individual avoids eye contact with you doesn't necessarily make that individual a trafficking victim. What we're looking for here is a combination in whole or in part of some of these things, and avoids eye contact with you. I interviewed an individual who was a victim of labor trafficking, and I asked him, I was like, well, so I like to have some research behind some of these indicators. And he was like, I don't look at people because I'm ashamed of where I am. I'm ashamed that I put myself in this position. And therefore, I'm attempting to hide my shame by not looking at you, by looking away. They're very fearful of their controller or the individual that's controlling them. They don't have their identification, much like the lady that I spoke about in California, who was a victim of domestic servitude. She didn't even know how old she was because she didn't have her identification that was taken away from her 37 years ago. And it was taken away from her because she couldn't leave. Now, are we going to see more of this coming in because of things that might be happening? Yes, obviously, we have to consider that. They may also, too, what Kelly will talk about is untreated injuries and fatigue and malnourishment. She'll talk about that in the latter part of this. Lacks their own transportation. And when you see people that are all in the same vehicle being shuttled from site to site, from restaurant to restaurant, from agricultural site to agricultural site, a lot of these are indicators. They don't allow people to speak for them, okay, when asked questions. And they may be unaware of their surroundings or what city they're even in regards to that.
So as Rich is saying, how do we identify these victims? They're hard to identify. And it is extremely complex because a lot of these, criminals are pulling these victims, isolating them, keeping them out of, the main things going on in the world. They're more underground and invisible. So they might move them to various locations to keep them out of the public view. So as we discussed, the most vulnerable are critical to identify, and we have to keep an eye on those in particular. And when you get them into your clinics, into your hospitals, your emergency rooms, wherever you are, understand these vulnerabilities. Know that if you have patients in these vulnerabilities, that they could possibly be a victim. So I'm going to talk a little bit more about those vulnerabilities. So we've already mentioned women, much more common. Children are especially vulnerable, and a lot of at-risk youth. So a lot of them, and Rich kind of mentioned this, but a lot of youth that are victimized have a history of chaotic homes where it's domestic violence, substance abuse, mental health needs. They may already be victimized physically or psychologically from a parent, guardian, or family member. So, they're in this abusive environment. And some, unfortunately, foster care is a big risk group for this, very vulnerable. And then also kids who actually come out of foster care, age out. And then, Rich mentioned this earlier about numerous studies were reporting a direct correlation between childhood sexual abuse and sex trafficking victimization. So those victims that have that history of sexual abuse were 30% more likely to be charged with prostitution in their lifetime. So that's a big issue. And so here's the main reasons that victims are often unidentified. So we miss this opportunity, as you heard Rich talk about the woman who, was in domestic servitude for years. She was in the hospital 3 times, and it wasn't until the third time. So they're hard to identify, but often the reason is because the victims don't self-identify. They don't come out and say, as I said, they're not wearing a t-shirt saying, I'm a victim of human trafficking. They're often threatened or coerced by their trafficker to remain silent, so they don't seek help. Traffickers use psychological control tactics, intimidation, and threats, either physical abuse or psychological, to control and silence the victims. When there are foreign-born victims, again, that's not necessarily the most common in our country. It's mostly U.S. citizens, but foreign-born victims have a real distrust for law enforcement, and they could be fearful of deportation. They may fear incarceration for crimes that they committed while they were being trafficked. So again, Rich mentioned some of these individuals are addicted to drugs. They might be doing crimes while they're under the influence. They may be doing things they shouldn't be doing. So they're now afraid that they're going to be incarcerated for those crimes that they're committing. And also, a lot of victims are perceived or mislabeled as prostitutes. They're charged with solicitation, so that obviously further perpetuates the victim's mistrust for law enforcement. And this is something too to just say, if the individual is underage, they are being trafficked. There is no 16-year-old that is allowed to go be a prostitute by choice. So whether or not, you look at this as, oh, they're wanting to sell, they're making an income, they're doing it on purpose, that is never okay when they're underage. But it is harder to identify as we get into, as they get older. A lot of law enforcement identifies them as prostitutes, which is another reason that Rich focuses a lot of training on teaching law enforcement about the difference, because there is a difference.
So let's talk a little bit about the victimization, some of the red flags. And remember, as I said earlier, that it's not just one of these indicators that makes somebody a trafficking victim, but it is a combination of all or part of some of these. If an individual is currently providing sexual services, whether it's in a massage parlor, on the street, at a hotel, regardless of the area, there's a high likelihood that person is being managed or trafficked by someone. Okay, it's unpaid or paid very little. And some people are like, well, how can you be trafficked if you're getting paid? And I'll tell you a story of an individual who worked in construction, who was recruited out of Nicaragua to come to the United States by an individual who had a construction company here in the U.S. And he was actually paid to work, but not a fair wage. And then he was also charged for transportation to and from work. He was charged for his room that he lived in, his refrigerator, his cell phone, his plug-in. He was charged to use the washer, charged to use the dryer. At the end of the day, he would come out with a negative number on. So he was an indentured slave. He had a debt that he still owed this individual, even though he was getting paid. He wasn't getting paid what he deserved, and was being overcharged as a way of manipulation and trafficking him. And he worked excessively long hours, even weekends. So, and we talk about that, unusual restrictions at work, not allowing the individual to engage. Not every restaurant, just because it's not, operated by a U.S. citizen, doesn't mean these individuals are being trafficked. But you obviously need to look for some of these key indicators, and maybe the fact that they can't talk to the customers, or they're not allowed to look at the customers while they're there. They're not allowed to use a cell phone while they are there. They may be recruited through false promises. There was there were two actually individuals who graduated from a university in South Korea, who were in design, and they came to the United States to work at a facility that made wedding dresses. And at the end of the day, they realized they didn't get paid what they should have been paid. These were, college educated females who were brought here under false pretenses to design dresses and be seamstress and build these and construct this. And the owner said, well, you owe me a considerable amount of money because I had to pay for transportation to get you here. Now you have to pay that off. However, if you want to make more money, I happen to own a chain of these massage parlors that you can go and work in after hours. And those massage parlors were actually used to sell sex and sexual services. So recruited on false promises. Avoid social interaction. A lot of these individuals, keep in mind, are embarrassed by the situation that they have put themselves in. And they avoid social interaction for several different reasons, but that's certainly one of them. And a lot of them have scripted responses. A lot of people may or may not have teenagers, but you know when somebody has a scripted response, they've rehearsed what they're going to say before they say it. And when an individual has a scripted response, there's a reason for that, because they were told or they rehearsed what to say before they actually say it. And then they attempt to legitimize bruises or marks that they may have on them. Much like a domestic violence victim, they legitimize why they have bruises on their wrists, why they have bruises on their shoulders, or strangulation marks on their neck. And they'll try to legitimize it again with scripted answers, because the trafficker will tell them, if someone asks you about this, this is what you tell them. And you'll see that in a clinical setting. It will be a scripted answer. And then tattoos or branding. I'll tell you that traffickers and pimps tend to place markers or indicators on their victims, and they use this as a means of branding property to let that victim know that you are owned by me, and this is my stamp, this is my brand, to indicate that I now own you. So we certainly want to look for tattoos, particularly those that might be odd. Not everybody has a tattoo as a trafficking victim. That's not what I'm saying. But those that might seem odd for them to have might be strong indicators of what's happening there. So we also look for signs of fear and depression. You have to look at the trauma that these individuals have gone through. And trafficking victims tend to go through every spectrum of trauma that there is. Some people just have sexual, trauma. Some people have alcohol. Some people have, drugs. Some people have physical or psychological. When you think about a trafficking victim, they run the spectrum on trauma and how they're affected. Okay. Most of them are submissive and tense. And they may be nervous and paranoid, particularly because that's a means of how they're being controlled by their trafficker. Okay. Very fearful or anxious or jittery, or always, and when you talk to people who have been victims, they're scared to even talk. They're scared by loud noises. If they hear a loud noise, it scares them because they're always on edge. And one girl had told me, she goes, I always felt like I was walking on eggshells. Do you understand that term? And I was like, yes, ma'am, I do. And she's like, I always felt like I was walking on eggshells because I didn't know when I was going to get a beat down next. And I didn't do anything wrong. It was just a way of him letting me know he could do it and it could come at any time. And she says, so I was always in fear, always in fear. They're often resistant to care and assistance. So when we talk about them visiting a healthcare setting, and Kelly will go into this more, but that is a prime opportunity for us to identify these victims while they're still in captivity. And if you want to use that term, because they are being held in captivity, right? And most all will have addiction issues. Most all will have addiction issues. So most in particular, we want to talk a little bit about minor sex trafficking, because it's important to understand we're starting to see more and more minors being funneled into this sex trafficking. A lot of them come from the homeless community. We're actually right now out looking for individuals, that have gone missing in the area that are high vulnerability to trafficking. They may be on medication, whether they're bipolar, schizophrenia, and they may not have their medication with them. They may not have any money. They may have to resort to survival sex, but they're homeless nonetheless, and that makes them extremely vulnerable. One of the things we also want to be concerned about is the presence of an older boyfriend, somebody that possibly groomed them online or offline. Okay, signs of violence, psychological control or trauma, Having some truancy issues is a big thing. When we look at delinquency and what causes the effects of delinquency, we need to understand that, a person that is being trafficked will be less obedient to their parents' rules, and, could be happening in any house, rich or poor, it doesn't really matter. Anybody can be a victim. Chronic runaway, research shows us that, chronic runaways are at higher risk, and law enforcement isn't designed to continually go after runaways because of the fact of how resource intensive it is. And a lot of people will have that mindset, oh, they've run away before, they'll come back. Well, we don't know that for sure, because research says 1 in 3 will be trafficked. So what do we say? Like, oh no, they're the 2 and 3, they're not the one that's going to be trafficked. You have to treat it all like the possibility of them being a victim. Obviously, we talked about the tattoos, but one thing that Kelly will touch on too is multiple STDs in the clinician setting. Okay, or substance abuse, or access to things that a youth can't afford. If you're looking at someone who is a teenager, how did they afford that Tiffany bracelet? How did they afford that necklace or that watch or those clothes, those boots, that purse? Because often traffickers will buy them nice things in order to shower them with gifts. That's part of like the Romeo, profile when we look at a trafficker, somebody who dons that person with gifts.
And that kind of, just perpetuates that cycle of abuse, where it's that mentality of, oh, I'm doing this to you, but now I'm going to show you love and accept you and give you these gifts. And so it's kind of that, typical cycle of abuse going on too. So the health problems that we see, so we're going to really dive into this about the clinical presentation and go into what you could do as clinicians. So this is no matter what aspect you are, if you're a nurse, a physician, nursing assistant, if you identify some things, and are able to, notice some of these things, just please share with somebody that could do this screening, and we're going to kind of talk about that. So a lot of the signs in these victims are that deprivation of food and sleep, extreme stress, hazards of travel and work, violence, physical or sexual, are there. And then the big thing here is this is something, when you think about victims not having timely access to healthcare, and Rich, if you want to go to the next slide. So by the time they reach you, so we know that in a clinical setting that someone may be abused if, like, you do an X-ray and you see, broken bones that have resolved maybe not correctly, and we see these older type of issues in patients. So some of that could be prevalent in these patients, but also things like, did the patient have a UTI and they waited 2 months to come in? Did they have an ear infection? Something simple things that you would think we would just pick up the phone and run to the doctor and do what we need to do to get it taken care of. You might see these well-advanced medical conditions that are real easy to solve. So that's a really big red flag for you as a clinician to identify. The multiple STIs, that's something Rich mentioned, seeing them come in. I had a kiddo, I was working in the adolescent clinic, and I have this one that I think about now. I didn't think about human trafficking back then, but she had so many STIs. She had abortions, and she was, I believe, if I remember correctly, she was only about 14 years old. And I think back to that, and I just wonder if she was possibly a victim of trafficking. And so physical abuse, torture often occur as well. We talked about broken bones, bruises, dental problems. So like, make sure you're always looking in the mouth. Dental problems, loss of teeth, cigarette burns. And Rich has mentioned some of this too, that they're maybe reporting anxiety, depression, PTSD, and, different symptoms such as aggression, shame, guilt, hopelessness. They can't sleep, maybe harming themselves, or even possibly being suicidal. And one of the things to remember too is that these victims might be intoxicated. So we think about the large amount of patients that are coming through the ED that are trafficking victims, right? They may be intoxicated. They may be withdrawing from some type of drug. And so a lot of times it could be looked at as, oh, that patient's just drug seeking, right? We just are, but consider looking into this and thinking about that being paired with the trafficking, okay? And don't overlook a patient and just think, they're just addicted to drugs and they're in prostitution. Consider looking into that a little bit more. You know, they might be hypervigilant or maybe avoid answering your questions. They may not want to and have that detachment. And this is one of the things that when I think back to that person I'm talking about, she had that trance-like state to her when she hardly wanted to answer my question. She looked away. She just looked kind of off in the distance and would just answer very flat affect, didn't respond much. The mom responded a lot for her, which in hindsight, I wonder was maybe a handler, maybe the trafficker themselves. I thought it was her mom. She answered a lot of the questions and the daughter hardly answered. And when she did, she kind of just looked away. She had no emotional connection to what was going on with her whatsoever. So that's something that's possibly happening. I do want to touch on, we're going to talk a little bit more about this too, but symptoms of psychological trauma may be present. Okay, so you have to remember that that's what's going on here. There's so much psychological trauma. So there might be minimization, denial, memory loss. So that can make it really difficult to get consistent information. It doesn't mean that they're lying. So if they tell you a story and then 20 minutes later they're telling it to a different healthcare worker and it's different, or maybe you bring in law enforcement and the story has changed, it's not necessarily that they are lying, that they're not telling you the truth. It's just that they possibly, it might be because of the psychological trauma. They also might be mixing up some of the facts of different situations. So just keep that in mind, that that doesn't mean, typically that's a red flag, right? If you, of knowing someone's lying, the story changes. That is not true in this case. I just really want to stress that. As I mentioned, the victim may not speak, the trafficker might speak for them. So even when they're addressed directly, the victim may not speak English, the trafficker may act as an interpreter or even be holding their documents. So this is one thing too that I want to mention. I actually teach a course at Chamberlain in nursing education. It's great. We were actually talking about cultural humility last week, and some of my students brought up that they have really done pushes to be more culturally aware and cultural humility by ensuring that there's an interpreter always used. And I don't know about you guys, but in the past, I have most certainly used family members. That is not a good idea. But I would work night shift. And so we would have a kiddo come in, and if a family member was there to interpret, that was great news. We didn't have to call the really cranky interpreter phone line that would be kind of mean to us because they didn't want to interpret at 3 o'clock in the morning. But I could tell you, call the interpreter, okay? Because just like that story Rich mentioned, these individuals may be trying to reach out to you and tell you that something's wrong, and you're not going to know because you don't speak their language. So make sure you use an interpreter, an authorized interpreter, not a family member. I just really want to stress that because, and I'm seeing that push just to be more culturally humble and cultural awareness and being, you know, better for our patients. And in an indirect way, it's going to help with this because we're not going to miss those patients that maybe have a handler with them, not their family member who loves them. Okay, so they might be telling you something different that they're saying. And then Rich mentioned too, not holding their own documentation is a big sign too. And so this screen that's on right here, you know, there's so many variables to victimization. They don't all need to be present. And I just want to mention that this red flag checklist is something that's available to you guys. And Rich, let me know how we're going to send that to everyone. Actually, I don't know if that's just going to go out via email. Is that?
They can locate this on the Hope for Justice website,
Okay.
which will be given it to them at the end, or they can happily email myself or you, and we'll provide them with the supplements to this training.
Okay. Perfect. So email us, or you could go to the Hope for Justice website, but this is a resource that is there for you. So look this over, know these red flags, look at this. And this was actually modeled after one developed for use by healthcare providers that incorporates that signs of trafficking for minors and adults. So make sure that you're looking this over here and there, you know, sharing it with your unit, sharing it with other healthcare workers so that they know. Okay, so let's say you identify a potential victim. Okay, so you decide that there's something off. So I think back to, you know, 14 years ago when I had this patient, and was that a victim? I'm concerned. Okay, so one of the things, and I'm going to talk about how what to do ahead of time as well. But one of the things, if they are of the appropriate age and you already have them alone, you want to provide them with information about what this assessment or screening, depending what your institution goes with. You have to ask them if they agree to do it. So it's like anything else. If they don't want to talk about it, they don't want to be screened, you can't force it. So if they don't agree, thank them for their time, give them some written resources of partnering agencies. And if yes, then wonderful, then we'll kind of go to the next step here. So before the screening, you want to think about this trauma-informed approach. Okay, oh, and Rich, can you go to the next one there? So you think of this trauma-informed approach. So I'm talking a lot about trauma, and one of the things that are important to remember is this is true around the world. In any language, in any culture, trauma is trauma. So when you think about that approach, it's really critical using that when screening individuals. So you want to be comfortable working with these victims. You want to know what to ask. You want to practice some of these things. I'm a big fan of doing role play with other healthcare providers so that you're comfortable asking these questions, because you want to be sensitive to their needs and just be aware that they're likely suffering impacts of traumatic experiences. And so the effectiveness of screenings for trafficking depends on decreasing fear, building rapport, asking questions in an appropriate manner, which I'm going to talk about. Techniques for the healthcare provider to keep in mind when screening include, before conducting the screening, you want to fulfill some of those basic needs for your victims. We were working with a SANE nurse recently and did a presentation with her, so you want to be aware of that. If there is a sexual assault going on that is aware, you might not do all of these things that we're going to mention, but you want to fulfill things like food, clothing, offering something to drink. So if you think back to like Maslow's hierarchy of needs, we need to get them those basic needs, right? We want to get them comfortable in something to eat, shelter if necessary. Maybe there's temporary shelter you could offer, ahead of time to let them know that they're going to be comfortable and safe. Again, I'm going to bring up the interpreter. Use a competent, trustworthy interpreter. So important. You want to have them ask the questions in the same way. Make sure that they're somebody that you could trust. Establish a safe space. The victim must be assured of confidentiality. So if you're just behind a curtain and the person who brought them in is right across the room and there's no barrier to a wall, they may not feel comfortable to tell you what's going on. You need to give true privacy. If you are concerned about this risk, maybe you pretend you're taking them for an x-ray, you pretend you're taking them to some test, whatever it is, but you need to get them completely alone out of earshot of the trafficker. It could also be somebody working with the trafficker that's with them. So I mentioned the handler. So keep that in mind. Maybe it's another, somebody else who's being trafficked. Sometimes they go into this new role of kind of being the handler of some of the girls or boys. As we've mentioned, it could be either or. And so what happens is they're almost promoted. So they no longer have to, maybe if it's sex trafficking, they no longer have to perform those duties, but they have new responsibilities now. So they no longer have to be the one trafficked. So they do this willingly. And so, I talked about that teen's mom that was with her. I don't know if it was her mom. You want to maintain a verbally neutral stance towards the trafficker. So we just talked about that the trafficker, it's so psychological. They might be giving gifts. They may be giving love and attachment. So I think about so much of why are runaways at risk for this? Why are kids with abusive homes at risk for this? Because what does every teenager want? It's the same thing as early 20s too. Let's just go with that whole category, and probably all of us, but we want to be loved and we want to belong, right? That's why people enter into gangs as well. They want to feel love. They want to feel family connection. They want to feel that. And if they're not getting that at home, they're going to seek it out. So just remember to be very verbally neutral about the trafficker, because otherwise the individual that you're interviewing may actually defend the trafficker. They may actually not like that you're doing that, okay? Don't rush the client, allow time, and I'm going to talk about some of those things. They may need to pause before answering and explain that that's okay, that you're not in a hurry. So it's kind of some tips before the screening. So now let's go to during the screening. So you want to periodically review that red flags checklist, as I mentioned, and look at the screening questions. And this is another resource we give you, and I'm going to talk about this a little bit more in depth in a second. But you want to be familiar with that so that you're comfortable talking about talking with somebody who's being trafficked, understanding this happens in all 50 states. Likely it's happened in your organization. So thinking about that and knowing that we need to get comfortable talking about it, that it's not, scary or whatever, and being real calm when you talk to the patient. So yeah, the more familiar, the more confident you'll be when asking these questions. And so you want to really be aware about that traumatic experience. I mentioned that. And so that's one of the things I like about these screening questions that we're going to talk about. And I'm going to read you a few of those in a second. But you also want to express prior knowledge and experience with similar cases where appropriate. So if the victim is talking about a situation, you don't want to act surprised or shocked. You want to express sorrow, tell them you're sorry, but you don't want to be like, oh my gosh, you're kidding. I never knew that happened. That's so crazy. That's terrible. Wow. That's, just be calm, like, oh, I've heard of these things occurring, or I've had patients before in similar situations, and I'm going to be able to help get you some help, give them some confidence in working with you. Be patient and sensitive to their fears of retribution and possible consequences. I talked to you earlier about why do victims not normally come forward and identify themselves, is because they may be fearful for their family members. They may be fearful what's going to happen to them if they're not rescued and they go back into it. They may be abused or have different issues that happen. So a lot of victims aren't familiar with laws and protections, so you may need to share that with them of how they will be taken care of. You can't obviously promise everything in the long run, but knowing that if they've committed crimes while they were trafficking, that was under duress, that was not their fault. So you want to kind of convey that to them. Convey trusting messages. We're here to help you. You could trust me. Your safety is my priority, and you have a right to live without being abused. As Rich mentioned, some of these victims, feel ashamed of what they've done. They feel that it's their fault. Maybe they did seek out something because they didn't have much money, so they feel it's their fault that they lost their job or whatever. You just need to let them know that nobody deserves to be treated this way, and this isn't okay. And there are people that will help them. Okay, so remembering, someone talked about the screening checklist here. So knowing that the basis of all adult trafficking involves the three things. If you guys remember what those are: force, fraud, coercion. And I'm sorry to say, I said that wrong. One of those three things. It can involve all three, 1, 2, or 3. Okay. So each question, including on this human trafficking screening tool, was reflected to get one of those core elements identified. Okay. The questions were identified as common across a number of screening instruments. Wording can vary. They're carefully constructed to include indicators often seen in both labor and sex trafficking. It's designed to be really short, easy to use, and hopefully you're able to build rapport and listen to the patient when they're talking to you. So that's, with our computers now in the clinical environment, everything is being documented over here. Take time to listen. This is where if you know some of these answers, you do want to take notes, but make sure you're looking at them and building that rapport and trust. The screening tool is used to assess for vulnerable populations, including those who have experienced sexual assault and domestic violence. Screening tools are instruments that help you know if a referral is necessary, and that's the goal of this. And the one thing I love about this tool is when I first started learning more about Hope for Justice, and I thought about the clinical environment, I thought about where I've worked and what could I do. This is one of those things that I just love so much, and there's a snippet of it right there on your screen. And one of the things, and again, you'll have access to this, you guys could change it if you want to. If your organization has one, great. If you have, this could be changed. But I do love the way the questions are asked on this. And I'm just going to read one for an example. The first one here says, sometimes lies are used to trick people into accepting a job that doesn't exist, and they get trapped in a job or situation they never wanted. Have you ever experienced this, or are you in a situation where you think this may occur? So it kind of creates that neutral tone of, is someone trafficking you? Does someone have your documents? Are you being forced to do this? You're not saying it in that direct way. It's more of like, sometimes this happens, this can occur. Is this a situation you're in or think you could possibly be in? And that's the goal of the way all of these questions are asked. And I'm going to give one more example. Sometimes people do unfair, unsafe, or even dangerous work or stay in a dangerous situation because if they don't, someone might hurt them or someone they love. Have you ever experienced this, or are you in a situation where you think this could happen? So again, I just love these questions. I love this tool. It's short and sweet. There's 8 questions on it. and you have access to this. And so if you do think there's a potential victim, this is a great way to look this over and go through it. Ideally, if you could beforehand, because as I said, it's better if you're more comfortable. But worst case, as long as you have access to that, you can know that you could use that and have that in your toolbox to use. So something to keep in mind. So I'm going to talk a little bit about this trauma and victimization. So remember, as a clinician who screens trafficking victims, you may be the first person that they've reported this trauma to or this mental distress. We saw that, 80-some percent, 87% come to a healthcare provider. You might be the first one to identify them and screen them and ask these difficult questions. So, think about this too. They've been experiencing oppression. They aren't able to make any choices. Complete control has been taken from them. So you want to also offer as much control as you can. So, so some tips to keep in mind with this trauma and victimization. Be aware that trafficking victims may experience long-lasting effects of psychological and physical abuse, traumatic experiences, chronic substance abuse, or violent psychological and physical assaults. So even if you're not a mental health expert, the screener can really learn to recognize some of these effects of trauma. And that's important to remember too. We're not psychologists. Maybe you are on this call actually, but to keep in mind that the goal here is to just identify people who need this help. Okay, that's the goal. Kind of like, I don't know about your backgrounds, but I was terrible with cardiac. That just wasn't my forte. Didn't know a ton about it. I worked in peds. So for me, I didn't have much experience with heart issues, but I knew if it was abnormal, right? Like I don't know what this rhythm is. I know it's not a normal sinus rhythm. So I could identify that there was an issue. And if you could think of human trafficking in this way, you've had this training today, and we're going to go into a little bit more. You are equipped through this to identify this. So understanding these effects of trauma, understanding how to use this screening is important. So I just want to stress that you're not expected to know every single answer of how to help these individuals, but just to identify them and get them some help that they need. So I've mentioned this too, express sorrow, don't appear shocked. That can really be difficult for the victims of trauma because now they feel like they're really strange. This is abnormal. This is something that they're all alone in this. And that's the worst possible way to feel in a situation like this for these individuals. They already kind of feel that way. But to know that others have experienced this too and that there's help for them is encouraging for them. Don't be judgmental. So if they've told you things that they've done while being trafficked, just be very neutral with that. Again, ask basic questions about mental health unless you're a trained mental health professional. So, a few questions in a kind way that you're asking, and then being able to refer them to a mental health expert for more help. And then be understanding when they don't want to repeat the details of the crime. So recounting stories many times, so maybe they're telling you and then they're telling the law enforcement officer, that can actually cause victims to re-experience the trauma. So try to minimize the potential for that re-traumatization whenever possible. So during the screening also, you want to avoid endangering individuals who have been trafficked. So it's critical that they resist that overwhelming urge to assist where you're overshadowing the client. So again, they've had no control. They've not been able to make any decisions. And one of the worst things that this is hard to hear, they may need to go back into that environment, and there might need to be follow-up after that for them to get the help that they actually need. So just know that you have to let them make some of these choices, and some of the ways that you could kind of set them up for that during the screening are listed here. Allow the client to set the pace, how fast they want to go through. Let them decline to answer any of your questions. Let them choose which resources they need. Make the call together to the referral hotline. Allow them to be a part of that decision-making process, because that can help them calm that fear and anxiety. When they have that shared decision-making, that's really actually a component of a survivor-centered approach and practice. And it signals that their needs and wants and their desires and priorities are important and they're valued. So it's really important to do. So I've mentioned that the effects of trauma, they've endured that physical and psychological injuries. So that can really impede the efforts of attorneys and other service providers, because when they're interviewing them, it may be a challenge because they may be forgetting some of those things. So this is where I mentioned a minute ago that they may have that minimization, denial, memory loss. They may give inconsistent information. So maybe you've screened them, you identify them as a victim, you're starting to get them resources, and again, their story changes. So just remember that that's really difficult, but bear with them, be patient with them. So at the end of the screening for human trafficking, always conclude by going back to their concerns. This is very similar. As I said, I'm a nurse. This is something we should always do. Any doctor, nurse, any healthcare provider, we should go back to the concerns of the patient. A question or two should be included about whether or not they're interested in referrals. Remember that when you're letting them choose, you're giving them some control, and that's really, really important to do with these victims. And you want to, again, I mentioned this a moment ago, but you want to make sure to maybe call the hotline together or call the resources together so that you're still doing that with them. You're getting them the help, but you're letting them be a part of it.
So just to kind of reiterate a little bit on what Kelly had said, you know, it's better to say something and be wrong than to not have said something and had been right. Because when we talk about raising this level of awareness, we know that the awareness leads to referrals and people reaching out and contacting, whether it's law enforcement or nonprofits. You know, a lot of times these victims are scared to work with law enforcement. They're scared because they may have an active warrant out for them, and they know if they get picked up at the clinical setting or they're referred to law enforcement that they're going to go to jail that night too. So a lot of times they're in fear, and we talked about that earlier when we talked about indicators. So we talk about nonprofits. We work, Hope for Justice works with a lot of hospitals and emergency rooms to respond to a setting where a victim does not want law enforcement involved and they need a safe place to stay. We have been happy to respond to that. And there's a lot of NGOs, great NGOs out there that are willing to assist and bridge that gap in getting that victim to a safe location other than what they are. Some of the effective responses that we see in law enforcement is the establishment of a task force, a human trafficking task force that includes not only law enforcement, but also individuals from the lawmaking, from the government, from clinical setting, from nonprofits, so they can all share this information together and look for trends and where we're going. And, you know, I sit on the Tennessee Bureau of Investigation's Human Trafficking Task Force, and one of the trends that we identified on there was the fact of runaway victims and how that the fact that they were mainly becoming trafficked after 48 hours. So we raised that level of priority in locating these victims sooner. And a lot of people weren't aware of that statistic until it was brought forth. Providing public awareness and advocacy, much like we're doing now with this awareness program, but also looking to combat current laws. We need to look at every sector that a victim could be trafficked in, whether it's the hospitality industry, whether it's the clinical setting, whether it be in hotels or motels or what have you. But look at those sectors and provide that level of training for them so that they have that. Provide better shelters, more resources. These victims, rescuing them is just an event. Okay. It takes that event to make it a process. You don't just remove them from the situation that they're in. That's the event and everything's great. It's not. This rescue is a process of getting them from the event of being rescued to trying to make their life holistic again. So improving the resources and the counseling and the rehabilitation that we have for them and driving the laws that allow that. It was only recently that victims, there was a law, SESTA, passed by the U.S. Congress that allowed them to go back and sue the places that they were actually trafficked at.
¿Qué tal?
So when we talk about recommendations, we need to increase opportunities for people to come into the country legally so that they can not be taken advantage of or trafficked or put into a vulnerable situation.
Muchísimas
We also
gracias.
have long-term strategies to do this as well. If you're not muted, if you just mute a little bit longer, thanks. And then raising the awareness like we had talked about. And then people often say to us, like, what do we do? Who do we call if we recognize somebody as a trafficking victim? Obviously, if it's something that is of an emerging threat and you think somebody is in danger, 911 clearly has to be who you call first. Contact 911. But if you're just suspecting somebody of being a trafficking victim, you can contact federal law enforcement in your area, whether it's the FBI, Homeland Security, local law enforcement. By all means, contact the National Human Trafficking Hotline Center. The National Human Trafficking Hotline Center will then reach out to law enforcement and nonprofits within that community of where the individual was cited. Or you could actually just reach out to us at Hope for Justice. There's a phone number on there. We have a full investigative staff that are made up of former and retired law enforcement individuals who are licensed investigators who actually work these investigations in concert with law enforcement. Like I said earlier, we work with several hospitals and emergency rooms to actually go there and rescue victims and take them from that setting and put them into a safe place. We have aftercare facilities across the U.S. So it's important to know that the process of rescuing somebody is more complex than just removing them from that situation that they're in. But that certainly is the first step in doing this. I do want to put up this slide that has the Hope for Justice website. You can find all different types of resources that are at this website for you to use. My email is on here, and so is Kelly's if you want to reach out to us. Right now, I'm going to turn it over to Kelly. I've been working with Kelly now for over the past 6 months to not only develop but deliver training to various clinical entities. And like I said, we were actually asked by the Department of State, who actually develops the trafficking in person report on a global scale, to develop and deliver training across the globe to clinical settings and embassies and consulates. And this was kind of a snippet of that type of training that we delivered. But Kelly has put in numerous amount of man hours. She's been amazing in helping deliver this training, but also helping build the curriculum. So Kelly, I'll let you take it from here.
Yeah, and thank you for saying that. That's one of the things I want to share with you guys is sometimes it's hard to hear all of this and feel frustrated and angry. And if you're feeling that way, it's completely normal. And one of the things I get asked a lot is, what can I do? And so I want to share with you a couple of things that you can do. You could go to Hope for Justice. We do have a guardianship program. I think it's $18 a month I give to just help one person. It kind of just gives, it's a small amount. You could do that. You could request training. So Rich and I do these trainings for free for anyone who wants to hear it. So if you have an organization that you are a part of that you would like your whole unit to hear this, or your hospital, or wherever you're at, we're happy to deliver those trainings. If you're here and you're not in a clinical environment, you can also go to Hope for Justice's website and say, hey, I'm a pastor, or I'm in law enforcement. There's training designed specifically for each type, and maybe not every single one, but there's different ones that get developed continually to train specific industries. So, and there's different things with Hope for Justice too. And if Robin, if you can, sorry, it's echoing really bad now. But I was going to say that we have different things too, where you can look at supply chains and make sure, thank you, you can make sure to ensure that you're not purchasing from different supply chains that maybe are trafficking people through labor. There's many things you could do in that way. And I just want to share my story. So when I first heard about Hope for Justice and I learned about it, it was years ago, it made me so sad. It made me sad and angry. I'd say the two. I'm not sure which was stronger. And I hated hearing about all these stories. And so it was really interesting. I wrote to the people at Hope for Justice, and I wrote to a random email, and I just said, I just want to help. Like, can I help in some way? I'm an educator. I want to teach. I want to tell people about human trafficking. I want it to stop. What can I do? And they contacted Rich and set me up to talk with him. And I just think it's really cool that I was able to use my skills, my background to help. And so I just want to encourage you, if that's something you're interested in, you could reach out to me. I'm working on some train the trainer things that I'm hoping to get more people trained to train. So if these are interests of you, just reach out to us, let us know. And, one of the things that I realized was just, it wasn't an excuse anymore for me to just say, oh, I'm sad. I wanted to do something and make a difference and do something to stop it. And so sharing this information with somebody, I've had people say, oh, I have a teenage niece or nephew, and I just reached out to them and asked them some questions about their online activity and making sure they're safe. So I think the more that people are aware this is occurring, that this isn't, you know, like Rich mentioned, what the media has turned it into, or you see online, oh, there's 6 people watching me at Walmart. And again, those things could happen. I'm not saying they don't, but I think it's really minimized human trafficking, and some people don't believe it exists. And I think knowing that it does, knowing to watch for it, knowing to be aware of when it's occurring and what you could look for is so important, so that you can report it to Hope for Justice, so that you can, you know, get this information so that people can investigate it. You don't have to investigate it. You just write to them and tell them what's going on. I know I've had people call Hope for Justice and say, hey, I saw this sign on the side of the road and it says, call this for great pay, with no organization associated. And so you could report that to Hope for Justice and let them know, like, I saw this, I don't know what it is, but you know, you could do that. So just to be aware that these things happen. And finally, I just want to mention that there's a great book by the founder of Hope for Justice, Ben Cooley, wrote, and it's called Impossible as a Dare. And one of the things I love about this book is that he shares horrific stories of where they've rescued victims, and just heartbreaking things, you know, things like, one of the things I didn't know was, when you think of somebody being trafficked, you might think, oh, they get trafficked once a day, they get sold to have sex with somebody one time a day. And in that book, he mentioned somebody that was trafficked, I believe it was 27 times in one day. So this isn't just like one person a day. It's horrible. But he always shares the after story of when these victims are rescued, when they go through those programs that Rich was mentioning, and just seeing, you know, saying that some of these people go on to get married, to have kids, to kids that were being trafficked that were terrified and sitting in the corner when they were rescued and couldn't speak and wouldn't raise their heads, you know, now running around laughing and playing, you know. So sorry, I get emotional every time I talk about this, but, you know, just knowing that this makes a difference. And it might take a few times. People who are running away from a rough situation may be rescued 7 different times because they've run away. But to just care for these people and to not let them be treated in this way, and just anything you do makes a difference. So kind of like, you know, you have somebody not breathing, and I know we've all learned as healthcare providers, do something, right? Something is better than nothing. And I would say that is true of this. Do something. Tell one person, share this training. And Rich, can you put up that screen one more time? Because I wrote it down. Sorry. April 28th will be our next training. We're going to do the same training. If some of you guys are watching this recording and you missed it, you're welcome to come to the live one, because we are going to leave time here in a second for questions. But it will be 8 a.m. to 10 a.m. Central Time on April 28th. And, you know, we hope you'll invite others, you know, let people know that you think would benefit from this training. Or if you want it at your organization, you're welcome to share that with us. Again, it's free. We're happy to come give a similar training to your organization and get them prepared and equipped to know what to do if they do identify some victims and know what to look for. So, and I'm going to open it up to any questions that anyone has at this time. Feel free to come off mute or put it in the chat.
I have a question.
Yeah.
This is Melissa Osborne from Savannah, Georgia. How you doing, Rich? Go Big Orange.
Right. Hey, Melissa, how are you?
Hey, I'm good. I know Rich from another lifetime. I'm actually a regional manager, and I'm a pharmacist by trade. And I manage facilities in 5 different states: Louisiana, Georgia, North Carolina, Virginia, and West Virginia. And I do meetings all the time with each facility, which it goes from all the way from the mental health technicians all the way up to medical directors and everything in between. And I would love to put a piece in my agenda to just introduce all of these people who could definitely make a difference in this area. And I didn't know if you have anything that I could include into an agenda that would be maybe a 1 or 2 page document that is kind of like an introduction for Hope for Justice that I could utilize in my talks.
Yeah, we definitely have that, Melissa, and I could send that to you under a separate email so that you could have it, that you could use. Also some spot to sign posters that you could actually use to put up at some of your facilities if needed. We've got plenty of resources that are out there available. Melissa, before Melissa and I know each other from way back, we were actually first office agents when we were both in the FBI in Kansas City. So it's great that you got on here, Melissa. It's great to see you.
Good to see you. Of course, you have to look at a picture of me because I would scare you if I got on in real life. But thank you so much for doing this. You all are doing very important work, and I'm one of these that would probably love volunteering or helping you in any way, particularly over here in the Southeast or anything. So thank you. Thank you for what you do.
Yeah, so I think the next question, Kelly, is what about screening tools for someone who is nonverbal or has a cognitive impairment and is unable to understand what is really being asked or consent?
That's a really great question. And I suppose you would use anything, again, an interpreter, that somebody that would interpret and be able to do that would be a great way to do that. I suppose you could also give them the checklist to answer the question. You could hand this to them and have them, the options are yes, no, decline to answer, don't know. I would say if it's somebody who is not able to answer, so you're suspecting trafficking in somebody who is, mentally disabled and that's happening, you would need to probably involve some others, who is the guardian of that person. Is it someone you're suspecting as a trafficker? So you'd almost go through the similar lines of abuse that you would at your organization to identify them as being in an abusive situation. So I would say to do that. Rich, I don't know if you have anything to add.
No, I think it's, you brought it up in the training, Kelly, that regardless of where you're from, ethnic background or country, trauma is trauma, fear is fear. It all looks the same. A smile's a smile. So whether you're in Africa and South America or in the U.S., the same expressions or micro expressions are going to be there, and that's where you're just going to have to rely on the nonverbal cues that they give.
Yep. Yeah, I think that's a great question, and I see training here in Montana, emergency preparedness. Yes, let us know. Reach out. And you can reach out directly to Rich and ask him and explain that better. He might be able to know who's best to do that training and what you're wanting and things like that. Or there's ways to go on the Hope for Justice website too.
Yeah, we are actually providing first responder training to various different entities that are in the emergency management field, because often they do respond to situations where there could be a trafficking victim, and the key is really training these individuals where trafficking and businesses might intersect. And as Kelly had mentioned earlier, this is actually just one platform that we have. I created a banking platform for the financial sector that was delivered to a financial institution that, 19,000 of their employees took the training, because when you think about it, it's a $150 billion a year business. So the banking industry is not immune to this at all. So it's important. Education within the school systems is another platform. Online grooming. Clinical is one that, Kelly's expertise as a, DMP lends to utilize in the development of this curriculum.
Yeah. And there's a question about looking at, in the clinical setting, what about looking in a patient's home, and looking at that. And I would tell you that those red flags, really, we kind of pulled out later some things that were specific to clinical, but that red flags checklist and the one that Rich will send out to everybody, you're going to email that to everyone, Rich, the checklist? Yeah,
I'm happy to email that out to everybody.
Because that's for anyone. That's for your community. I know one thing I've learned is, watching things like if you're at an amusement park and you notice a person goes into the bathroom with a person and like a child, like a younger child, and then someone else comes in the bathroom or is waiting for them, then was different, that could be a sign that they're being trafficked right out in public. You could be aware of just things that are off, and just paying attention to those things. But I would say that checklist is great for anybody. I mean, that's for out in the community, and when you're going into someone's homes. And Rich, I don't know if you have additional things to look for specifically in a home that you're going into to identify this.
Well, I think you have to just be cognizant and aware that things that stand out, and you often tell people if it looks odd and out of place, and it probably is odd and out of place. And there's a reason why that we have intuition, and there's a reason why that we suspect things. And I always say never jump to conclusions, but also too, don't be an ostrich and put your head in the sand either. We've went for many, many years not talking about human trafficking. It's not that it's become more prolific by any means. It's always existed. We've just refused to recognize that it exists in our neighborhoods. We've always said it happens somewhere else. It doesn't happen here, when in fact it does. And it's just as prevalent here as it is anywhere. I can tell you that there's probably no county, I know for a fact there's no county in the state of Tennessee that did not have or report a human trafficking case in 2020. And, so we have to look at every state is a member of this fraternity. Human trafficking is on the rise. And it's on the rise for a reason. It's a money-making venture. And like I said earlier, that these individuals are businessmen, and they know that they can only sell that drug once, but they could sell that individual over and over. It's a reusable commodity. And we have to be in a position where we recognize that.
Yep. Rich, they're asking if there's any previous recordings to send out.
Yep, I do have we do have previous recordings in different sectors. If you email me or Kelly, I'm happy to send those out to you. For privacy reasons, we typically don't broadcast these on YouTube or any other place, because it's got everybody's name on here, and I respect everybody's privacy for doing that. But we do have pre-recorded things. I also will answer a question. Somebody said, yeah, would you share your PowerPoint? Would you share your notes from this? Yeah, I'm happy to do that as well. This information shouldn't be safeguarded. It's not top secret. It really should be shared with you so that you can share with other people that need it, or in a position that need it.
And then there's another question. As a mom of an adopted, rescued little girl, we need references to care for these little people once they have been rescued. Is there anything like that on Hope for Justice with someone who has been rescued?
Yeah, absolutely. And we do have, trauma informed care presentations that we do. And I also think that it's important that we understand, as I said earlier, that the rescue is a process. It's not just the event itself. And even though your little girl is safe, now, it doesn't mean their trauma is still not being recognized by them. So yeah, certainly.
And then Robin's asking, in a massage parlor, how or who can identify trafficking?
I certainly think that anybody, when you go into these massage parlors, one of the things that we try to do when we look at massage parlor and the intersection of commercial sex trafficking is that we will look for the advertisement of that phone number or that massage parlor on websites that advertise for sexual exploitation, and try to get a reference to see if there actually are being trafficked within that massage parlor. A lot of times those victims do not speak English, so there is that language barrier. A lot of times they have a debt to pay back, and it takes a great amount of resources and manpower. A lot of people say, why are these victims not being identified quicker? Why is law enforcement not doing what they should be doing to get this done? They are. Law enforcement is doing what they need to do. There's just not enough of them. And you've reached that marginal rate of return where trafficking and the intensity and resources that go into investigating human trafficking supersedes the availability of law enforcement to find it. They're very resource intensive. We worked a massage parlor case. There were 4 investigators, and it took us 6 months to put the case together. That's a long time to do it, but we were able to free 6 women. And, so you can't really put a time or a price on a person. On a rescue. So you do what you can, but you have to look for these red flags. And, a lot of times these massage parlors are both labor trafficking and sex trafficking. And they come over here to the United States for a better life. And they respond to an ad under false pretenses. And now they're here. And now they have no place to go. They don't speak the language. They have no documents. They have no money. And they know nobody. So, and often sometimes the situation they're in now, unfortunately, might be better than it was from the country they came from.
Yeah. And something to add to that too, is if you suspect something, contact Hope for Justice. That's why we're saying call the hotline. If you see something weird, you're not an investigator. I'm not an investigator. It frustrates me sometimes because, we talk about all these things and I'm like, I want to get into that and know what to look for, be able to stop people from doing this, but that's not my specialty. But there's people that we have at Hope for Justice or in other organizations too, that are trained to be the investigators. So you just need to say, hey, I identified this as an issue, contact Hope for Justice, say, I've seen this going on here. I think something's happening. There's this possibility, and then they can investigate that and look into it and see if there is an issue. So I would always say something. If you are curious, it's not going to hurt anybody to say something and let it be investigated.
Like I said, it's better to say something and be wrong than to not say something and had been right.
Yep.
So, and I think that's important. And Brian, you ask, is we ever done any webinar like this for foster? Yeah, we did. It's not recorded, Brian, but we have, and we'd be willing to do it again, because we do know that is a very vulnerable community. So, men's group searches. Yeah, Chrissy, we actually do. Chrissy asked, have we done a webinar presentation for men's groups such as churches and sporting events? Not all men are consumers, but they're the majority of consumers. Well, I was at a conference this past year for the Police Executive Research Forum, which is PERF, which is a leading research body in criminal justice and criminology, and it's made up of police executives and research professors and criminologists. And one of the ladies from John Jay College was doing a study, and she did a survey of men, and 8 out of 10 men responded that they would pay for sex if it was legal. 8 out of 10 responded that they would pay for sex if it were legal. 7 out of 10 responded that they would pay for sex if they knew they wouldn't get caught. So it only changed one deviation of one person, whether it was legal or whether they knew they wouldn't get caught. So the demand is certainly there. And yes, certainly educating people about this, because you look at it from the side of the buyer. They're not going online looking to buy a trafficking victim. They're not searching online for a trafficking victim. They're searching online for sex. That's what they're searching online for. They're not explicitly looking for trafficking victims. It is the production of the trafficking victim, is the pimp, the trafficker. They're filling that buyer's need by pushing that person into sexual exploitation. And that's where that intersects at. So certainly, education of men at church groups and raising the awareness of everybody that this does happen. It's not acceptable. Okay. And these are the people, these are the real victims. They're somebody's daughter. They're somebody's sister. They're somebody's mother, cousin, niece, nephew. It could be anybody.
And they're asking about where did I lose it? Oh, reporting being a HIPAA violation. Just to touch on that, if it is underage, an underage individual, you could kind of treat it the same you would if you suspected abuse. I would say that think of it that way, and how you would go about reporting that, because you're a mandated reporter, actually, typically. So you would want to report that this is abuse. But also, if it is somebody who is an adult, and Rich, I'll let you touch on this a little bit more, but this is where you have to ask if they even want to be screened. You have to ask what resources they want. We can't force it on them. We can't force them to say yes to the screening. So, and that being said, it's still their right to say no, as far as I'm aware. But Rich, I'll let you touch on any further.
Yeah, you're absolutely correct. But the way around the system is to talk to these victims, and one thing Kelly brought up is to make sure that they drive the interview. It's important for them to drive the interview, what they feel most comfortable with, but to keep eliciting responses to them, to letting them know that there's help out there. And you don't have to go to law enforcement, because oftentimes you will see that these victims are willing, majority of the time, willing to talk with somebody outside of law enforcement. And then that angle can be worked from the NGO, because you keep in mind there's a victim out there. And I always try to keep that in mind. There's a victim out there, but there's somebody that made them that victim. So we have to look beyond just that victim and make sure that we hold this perpetrator, this trafficker, this pimp accountable for his or her actions, because nobody says, I'm just going to traffic one person and then I'm done. That's never the case. Okay. Usually it's multiple victims. So we have to start holding them accountable and not just realize or have the mindset, okay, she's rescued or he's rescued, we're good. That's not the end of it, because this person is going to keep doing what they're doing because of the money that's involved in it, and sometimes just the sheer heinous evil. So, we have to look at it that way. We have to look at it from twofold. Prosecutions are certainly needed in this.
Yeah, and often social workers. I know on my unit that I worked on, our social workers were some of our best people to work with different, individuals. And so, this is where it's a great opportunity right now for wherever you work to look into that. What is your process? Your hospital or organization may already have something in play with this. So it's good to ask. And if not, then it's maybe time to develop something so that your staff knows what to do specifically for each organization. So I saw some, and yes, I saw somebody say, Samila, am I saying your name correctly? But to say that, sharing this educational opportunity, yes, please, we're happy to come talk. We just talked to a nursing school, about a week ago. We've talked to different people. We're happy to share, to have them attend or have them come to the next one, or if you want to make it at a time that it's available specifically to your organization, that's great too. We want to keep sharing, so that's great. Oh, has there been steps at the state and federal level to decriminalize the ones trafficked? I've seen some steps with that recently, but Rich, I'm gonna let you talk on that.
Yeah, certainly there are some acts out there to wipe the record clean of the individuals that have been trafficked. I can recall specifically a victim who actually went into a store and she purposely got herself arrested for shoplifting just to try to remove her from the trafficking situation that she was in so she could go to jail. And her trafficker came and bonded her out of jail and beat her profusely. But when the police came to look for her, again, to arrest her for the shoplifting that she didn't show up for at court is when she was finally rescued and she told law enforcement what had happened. But certainly there is efforts made to wipe the records clean for these individuals. Right now, there's a class action lawsuit against several major hotel chains by trafficking victims because we passed into federal law a couple of years back that victims can now sue these places that facilitated their trafficking, whether it be hotels or motels or whether it be websites, to allow these victims some compensation for what has happened to them. And I think it's great that we continually pass these laws that assist with helping these victims not only start their life over, but also to give them some compensation, civil compensation for the trauma that they've been through.
I saw Brian mention too that foster parents are mandated reporters. And, I would just say you can always be anonymous in things you do too, and reporting things and reporting what you know. There's ways to go about whatever it is you need to do to report. So just consider that too. It's someone's life and, just say something, reach out to someone, get some information out there, even if it needs to be in an anonymous way, but just so someone can look into it. But thank you guys for being here. And I don't know if there's any more questions, give it a second, but we appreciate your time. And just, again, check out Hope for Justice at their website and, see the resources that are there. Also, if you have a chance to read that book, it's such a good book. And just, consider telling someone, doing something, just sharing with your unit, taking this checklist, sharing it with people where you work, and, considering using that or something similar. So the book is called Impossible is a Dare, is the book. It's really good.
I posted the Hope for Justice website in the chat box along with my email address and Kelly's email address. Feel free to reach out to either one of us or go on the website. There's a lot of stories on there about victims we've rescued. There's also some spot the signs in various different languages and resources for you to have access to. But certainly if there's anything in specific that you want, feel free to reach out to myself or Kelly, and we're happy to engage with you and your organization or just you individually. So I want to thank everybody for joining us for this. Kelly and I are committed to doing this webinar once a month at various times. So we will push out another invite, and I don't think you probably want to sit through it again, but you're happy. We would love for you to share that it is worthy training with those that you might know, so that they may also benefit from this type of training. So thank you, and hope everybody has a great holiday Easter weekend, and we thank you for joining us.
Thank you.